Hi, this is Dr. Tyler Merceron with PRMA Plastic Surgery, and I wanted to talk to you a little bit about the differences and pros and cons between an autologous or flap-based reconstruction and implant-based reconstruction. Um, in general, people think about implant-based reconstruction as maybe a smaller procedure in that it takes less time in the operating room and you're in the hospital for less time and have less recovery time. But really, over time, implants require some maintenance. The FDA recommends that you monitor your implants with an MRI every 2 to 3 years after the 5th or 6th year that the implant is placed to screen it for rupture. The potential things that can happen whenever a foreign body is placed in your body is that foreign body forms scar tissue around it, and that is called a capsule, and sometimes that capsule can become tight. These are just some of the long-term things that can occur with implants, even though it's a shorter procedure. Flap surgery takes longer to perform, particularly free flap surgery, somewhere on the order of 6 to 10 hours, depending on how your anatomy is and what you need done. You're usually in the hospital for 2 or 3 days after the surgery. But one of the major benefits of flap reconstruction is that it's your own tissue. So it ages with you. There are no foreign bodies in you after a flap, and you don't have to really monitor for anything like you would long-term for an implant.